Cancer of the cervix is on the top list of the cancer type women suffer. But the good news is that it can be prevented and treated if detected early and managed properly. But the irony is that most women are not aware of this deadly disease. Neither do they even know the signs and symptoms of this disease until when it has gone beyond repair. And that is why I thought it wise to create awareness about this deadly disease ravaging the health and life of our women, so that with right information we can live a healthy life, reaching our maximum potentials in life to the glory of God as women. So if you are seeing me for the first time and you have not subscribed to this channel yet, please subscribe to this channel, hit our notification bell so you get notified each time I post in new videos. I am Nurse Z and welcome once again to Antenatal Faith Clinic. Cervical cancer is a type of cancer that occurs within the cells of the cervix at the lower part of the uterus that connects to the vagina. The cause of cervical cancer is unknown, but 99% of cervical cancer is linked to an infectious virus known as the human papilloma virus, transmitted through direct contact and get into the body through sexual intercourse. There are over 200 types of this HPV virus, each of them having a number. Some of them cause cancer of the cervix and other parts of the body. They are known as the high-risk type, while others cause diseases like warts, hence known as the low-risk. But when diagnosed early and properly managed, this disease can be successfully treated. There are two types of cervical cancer. One is known as the squamous cell carcinoma, and the other is known as the adenocarcinoma. Each of them is distinguished by the appearance of their cells under the microscope. Some women have higher risk of developing cervical cancer, and that is where the risk factor of cervical cancer development comes in. So then, what are the risk factors of cervical cancer? One risk factor of cervical cancer development is having multiple sexual partners. The greater your number of sexual partners, or the greater the number of your partner's sexual partners, the greater the chances of you acquiring human papilloma virus. Therefore, let every woman stay faithful to her husband, and let every man stay faithful to his wife. Another risk factor is early sexual activity. A woman who starts having sexual activity at an early age stand the risk of developing cervical cancer. So young lady, young girl, don't be in a hurry. Delay sex. Protect your health. You see this sex of 18, you will do it until you get enough of it. So protect yourself, delay it for the future, for your well-being. The presence of other sexually transmitted diseases like HIV, like syphilis, like chlamydia, like warts, all of them can increase the woman's risk of having cervical cancer. Another factor is when the immune system is weakened by any disease or by lifestyle or whatever means. That is why women, you need to live a healthy life. Eat well, maintain good nutrition, rest well, relax, exercise, and then stay hydrated always. Drink water. Water is life. Another factor that increases a woman's risk of developing cervical cancer is when there's a family history of cervical cancer. If the mother, the auntie, the grandmother, or any close relation suffers cervical cancer, the woman is also at risk of developing cervical cancer. People who smoke are also at a very high risk of developing cervical cancer, because smoking weakens the body's immune system. And when the body's immune system is weak, how can the body fight against cancer? Another risk factor is this: a man whose wife died of cervical cancer and now remarry, then the second wife died of the same cervical cancer. The third woman the man will marry is at risk of developing cervical cancer, because from indication it shows that this man is a carrier of the human papilloma virus. He's harboring it. There's this drug called silvesterol, commonly known as DES. is an anti-abortion drug or anti-miscarriage drug, usually given to women in the early 50s. Then, to those who have risk or who have threatened abortion or who are at risk of having a miscarriage, this drug is given. If during the early 50s your mother, while pregnant for you, had that drug, that individual also stand the risk of coming down with cervical cancer. So then, what are the signs and symptoms of cervical cancer? The early signs of cervical cancer, the signs you will see, and you will begin to look or source for medical intervention immediately. Remember, I said early dictation is postcoital bleeding. You are not a virgin, and then after sexual intercourse you see blood. It is an early sign of cervical cancer. The next sign is bleeding after menopause. You know you have reached menopause and suddenly say seeing blood, or say seeing a kind of spotting of blood coming out from your body. It could be an early sign of cervical cancer. Another early sign is vaginal bleeding, bleeding in between your period. It could be slight bleeding, it could be heavy bleeding. Whichever it is, it could be an early sign of cervical cancer. When you start seeing vaginal discharge that is so watery, so offensive, sometimes you may see it with spotting of blood spot and all that. It also could be an early sign of cervical cancer. Now, what are the advanced signs of cervical cancer? That is when the cancer has gone beyond the region of the cervix. Number one is difficulty in bowel movement. You find it difficult to pass stool. Even when you pass stool, the stool come out with blood. It's an advanced sign of cervical cancer. Difficulty in passing urine. And when you pass the urine is coming out with blood. It is an advanced sign of cervical cancer. Dull back pain, leg swelling, abdominal pain, feeling of tiredness, exhaustion, confusion, all these are advanced signs of cervical cancer. There are other medical conditions that can mimic these signs I just listed above. However, to rule out cervical cancer, it is good you go to the hospital so that you can be properly examined. I know in your heart you'll be asking, tell us please, how can we prevent this deadly disease from happening to us? Okay, now listen to me. One of the ways you can prevent cervical cancer is regular screening with pap tests. These pap tests help to detect any abnormal cells present in your cervix. And also test for HPV. This is also to detect the presence of that bad guy, the presence of that human papilloma virus. And when these precancer cells are discovered, they are treated properly. And then that individual is prevented against development of cervical cancer. Another way cervical cancer can be prevented is receiving or getting the HPV vaccine. And this vaccine is usually given before the individual becomes sexually active. Of course, another way you can prevent cervical cancer is limiting the number of your sexual partner. I want to give us a simple code for practicing safe sex. The ABCD of safe sex practice. A stands for abstinence. B stands for be faithful. Be faithful to your partner. C stands for use condom. And the D stands for delay sexual debuts. Delay sexual activity. If you want to stay safe, if you want to prevent cervical cancer from happening, you should practice safe sex. And then smokers should quit smoking. Remember to do your cervical pap smear. And this pap smear is done every 3 to 5 years. The screening is not painful, but you may feel a little bit of discomfort that may make you uncomfortable. But it's worth doing. It's worth doing. It is also not harmful during pregnancy, except when contraindicated. After all this investigation is done and they suspect cervical cancer, you may be subjected to other deeper tests where deeper tissues from the cervix is being collected through a procedure known as colposcopy. And then when it is done, they will take it for biopsy. This is just to give a clearer view as much as possible of the nature of the cervical cancer. Treatment options for cervical cancer include drug therapy and chemotherapy, radiotherapy, surgeries, and immune therapy. Right information, they say, is key. That is why I am constantly grateful to all of you who share my videos. And we also share this one too. Cancer of the cervix is one of the cancer type that is totally preventable and treatable if detected early and managed properly. And on your own part, you do all the necessary things you need to do to protect yourself against this deadly disease. Thank you so much for coming around. See you next time. Bye-bye.